This patient was referred to me a year ago, as you can see right here, for evaluation and possible endodontic retreatment of tooth number 19. According to the patient, this root canal was done 20 years ago. And patient says she has had no symptoms with the tooth. And so we took a look, and it looks like a little lucency here, Look at that post. That post is not doing anything. What is that post doing? Nothing. Literally nothing. But I'm glad that this post hasn't caused a vertical root fracture of this distal root there 20 years later. But anyways, I told the patient that percussion palpations were within normal limits, probings were within normal limits. I said, let's just keep an eye on this tooth. Let's not. And this is another angulation of the tooth. Look at the lucency here, and again the post, and maybe there's a little something here. And I told the patient, you don't have any symptoms. This root canal was done so long ago. Let's just keep an eye on this tooth. And she agreed. Again, that was when I saw her first a year ago. All right, so she came back yesterday, so I can take a look at the tooth again. So let me put the radiographs next to each other, from this radiograph, from the radiograph that we took yesterday. All right, so now take a look. So this was a year ago, and this was yesterday. Look at this area here. And Loud, look at this area. You clearly can see that there's more resorption of the root in the apical area compared to a year ago. So that was a year ago, and that was just yesterday. And it looks like right now there is something going on here. That wasn't there a year ago. And we're comparing kind of two similar angulation PAs. You need to find two similar angulation PAs. You can't compare a PA that was taken in one angulation as compared to a different angle. And so find two similar angulation PAs to compare. Okay. Well, it looks like we need to go ahead and redo this root canal now. So patient still doesn't have any symptoms, but it looks like there are some apical changes happening here, periapical changes happening here. So we're going to go ahead and redo the root canal here. And of course, I know already I'm going to need to place an MTA plug here because of the apical resorption of the root. This is going to be large apical diameter, so I know I need to put an MTA plug here. So I'm ready for it. This 13-year-old patient was referred to me for evaluation of teeth number 7, 8, and 9. About a month ago, he was biking and he fell off of his bike and traumatized these 3 teeth. According to mom, these 3 teeth were partially avulsed. He was taken to his dentist, and his dentist, as you can see, tried to approximate these teeth back into their positions and wired them. And patient was referred to me. You can see a periapical relucency here, another one here, and another one, smaller one, starting to form there. On examination, they were slightly mobile. I would say maybe class 1, Miller class 1 mobility. Tender to percussion, tender to palpation, and they did not respond to cold. As you can see, open apices. So next time, what we need to do is we need to go ahead and sedate him and do all 3 root canals in one appointment. Or of course, I'm going to be placing MTA plugs in all 3 teeth. So stay tuned. This patient was referred to me for evaluation and possible endodontic retreatment of tooth number 7. According to the patient, the root canal was done a few months ago, so 6-7 months ago. And patient says he has no symptoms. As you can see, there's a periapical lucency here. So again, in situations like that, I will contact the general dentist who did the root canal 6 or 7 months ago and ask for x-rays of the tooth before the root canal so we can compare the size of this periapical lucency to the size of it today. Okay. So we're waiting. We called yesterday. Called the dentist. The office was closed, so we're gonna try him again today to get an X-ray of the tooth before he did the root canal. All right, so stay tuned. That's what we need to do. If he has symptoms, then I'd say we need to very likely redo the root canal. But because it doesn't have the symptoms and this root canal was done just recently, these root canals. Well, let's talk about these two. These two root canals were done, according to the patient, 2 or 3 years ago here in SAC. Okay, so patient has no symptoms. And take a look here. We have a broken file. And that broken file is actually out of the root. So according to some of you, this patient, every time he bites down on the tooth, he's gonna be in excruciating pain, right? It's because that's what you're imagining. You're imagining that every time the patient bites down, this broken instrument stabs into the bone and the patient will be in pain. Or if I percuss the tooth, this tooth is extremely tender, sensitive to percussion. Nope, that's not the case. Again, the root canal was done about 3 years ago according to the patient. No symptoms, no periapical lucencies, no issues. Now look at tooth number 15 now. According to the patient, the root canal was done originally in Romania about 10 years ago, and it was redone 2 or 3 years ago here in SAC because according to the patient, the tooth was abscessed. So what is that right there? That's another broken file. So anyways, again, patient has no symptoms. You can see it right here as well. And you can see that, I don't know what that is. Right there, looks like maybe either, I think it's not a broken file. I think it's got a percha sticking out. And maybe a periapical lucency right there. But patient has no symptoms, so we'll just monitor the tooth, and you can see that broken file there again, right there. And you can see tooth number 12 was obturated short, and you can see it doesn't matter. If the canal was instrumented to length and it is void of microorganisms, then yeah, doesn't matter. Short, long, broken file, out, sticking into the bone, broken file here, yeah. No issues, no symptoms, no problems. Now this root canal was done in Romania about 10 years ago, and this tooth was very tender to percussion, and you can see why. There is a large periapical lucency right there, so we're going to have to redo that root canal. This root canal was done according to the patient 2 or 3 years ago, and very, very tender to percussion, and it looks like a periapical lucency starting to form right there. So we're gonna need to redo these root canals. All right. These two root canals were done here in the USA 2 or 3 years ago. Patient has no symptoms here. Maybe there's a periapical lucency there. I don't know. Percussion, palpation, all within normal limits. Maybe there's a little something here. So we'll keep an eye on these two teeth. I let the patient know. But look at teeth number 4 and 5. These root canals were done in Romania. And take a look here. Periapical lucency here and large periapical lucency here. All right, so we're gonna have to redo both of these root canals. And look at tooth number 2 and 3. Yeah, I don't think there's anything there. And maybe there's a little something here.